is Dr. Daniel Kwon, and I'm a medical oncologist at UCSF who specializes in advanced prostate cancer. One of my interests is supporting and empowering patients to make high-quality decisions. And so to do this, I'm creating a series of short videos breaking down the steps of making a high-quality decision. I'll also be joined by a patient advocate, his name's Fred, who's going to share his particular journey of having prostate cancer. He'll provide sort of a real-life story to this. So if you have prostate cancer or you have a loved one with prostate cancer and you're going through a decision, then I hope this is helpful for you, even if you don't find Fred's particular story applicable to you. So in this first video, I'm just going to be going over some background information. I'm going to describe what is a high quality decision and why does it matter? Why should I care? So the way I think about it is that a high quality decision is one that is well informed and preference sensitive. And so the first part of that is well informed. What does that mean? Well, it means that you should have accurate and complete information. And so when we talk about cancer information, that usually comes in a few universal flavors of types of information that one needs. One thing everybody should know is stuff about the cancer. What type is it? Where is it? What's the stage? The second thing is, what are the options? You should get a menu, a list of options, and know what each one entails, what it involves. And for each of those options, you need to know the risks, which is oftentimes side effects, but there are other types of risks too, like financial, as well as benefits. What's the point of it? What good is it going to do for me? Prognosis is a last piece of information that sometimes it's hard to talk about, but it's something worth exploring with your doctor if you're ready. Now, the second part of what I said goes into a high quality decision is preference sensitive. So I'm talking about personal preferences. What matters to you? What do you prefer? And this is important because they matter. Everybody's life is different. We're all individuals. If we were to give 100 people with the same exact cancer, the same information, they're all going to end up choosing and deciding different things because they're all unique people. And so by preferences, I'm talking about a broad array of things like goals, values, priorities. Somebody might have a particular birthday that they really need to attend, and that might be a goal. A particular priority might be to be pain-free. A very common goal is to live as long as possible or to control the cancer. And so it's really important to think about personal preferences. Now, the second part to all this is why does this all matter? There are a lot of reasons, and perhaps some of them might be obvious to you. You need accurate and complete information and incorporation of your preferences to have agency, to have control over your life. Another way I think about this is, well, what does it look like if you don't make a high quality decision? Well, you might be harmed. You might be filled with tremendous regret after the fact. And I've seen countless patients go through this. And I can just give you a few examples. I've seen patients where they go through a treatment and they were not informed or didn't remember what have you about the particular side effects of that treatment. And after they suffered that, they were blindsided by it. And afterward, they were angry, mistrustful with the doctor and the system, not wanting to go through with a lot of the treatments. And that's just not good. It's not right. It's not ethical. I've also seen patients where they did not know or were aware of or were not informed of the particular existence of a treatment option. And way later they find out, wait, how come my doctor didn't tell me about this? Or how come I didn't consider this option? I would have wanted that, not what I ended up going through. And another example is sort of the opposite of that, when they actually go through with a treatment that was more aggressive than what they would have wanted. A common situation is when somebody is towards the end of their life and they're being recommended a particular treatment that's maybe just way too aggressive, when in reality they wanted to take a step back and take a more quality of life oriented approach. And had they been offered something like that, they would have taken it. So, there are a lot of different reasons why it matters to make a high quality decision. The ultimate goal is for you to decide something that makes sense for you. And you is really important because you are different from everybody else. Your particular cancer, your body, your life, your goals, priorities, very unique. So I hope with this video, I hope you understand what broadly goes into making a high quality decision and why it matters. And in the next series of videos, I'll be super happy to be joined by Fred, our patient advocate. He's going to give us his particular story on his prostate cancer and his thoughts on the decision-making process and lessons he's learned. And together, we'll just go through these steps together. Thanks.